Well, there have been some changes in the way of estimating risk. The original score charts have been updated to accommodate HDL cholesterol, and also there's a new concept of risk age, and that's been quite helpful in communicating to a young person at fairly low risk because they're young but with lots of risk factors. So if you're say 40 but you have a whole very heavy burden of risk factors, your risk may be the same as somebody who's 60 with no risk factors, so your risk age is 60. So you can go back to being 40 by attending to your risk factors. Then there are now 4 categories of risk: very high risk, moderate and low risk, the management is tied into those. So if, for example, we take the lipids and the cholesterol and the LDL cholesterol targets, for the high risk people this is a slightly tougher target of 1.8 millimoles per litre, 70 milligrams per decilitre, less than that. For the medium risk people, or for the high risk people, it's 2.5, and for the lower risk and moderate risk people it's under 3 millimoles per litre, which is fairly close to other guidelines internationally. Well, the difficulty with the risk is that it's a continuum, and we just had high and low risk before, and that meant a lot of moderate risk people didn't get adequately managed. Also, the evidence base from the trials supports slightly more vigorous LDL cholesterol targets than we used to use. Well, there's been a lot of interest in this at this conference, going beyond the guidelines really. The first point is that the trials that have been done of drug treatments have focused on LDL cholesterol as the target and not at HDL, and that's partly because we haven't had very effective treatments for increasing HDL. That's all going to change, but the focus is going to be not quite so much on the level of HDL cholesterol as its functionality. We're beginning to realize it's not just the level, it's how it works is important. There's also dramatic new developments coming with new drugs over the next year or two, a whole different classes of drugs that will lower cholesterol even more and will really push up HDL. So it's going to be a very exciting couple of years. Yeah, there's quite a literature on that. Quite frequently clinicians feel the guidelines are simply too cumbersome and too complicated, and we worked very hard with the new prevention guidelines to shorten them. They're about a quarter as long, and to simplify them very considerably. Then often they're just under time. Often their training is in treating people, not helping people to be healthy, and then very often they're paid to treat ill people and they're not actually reimbursed to keep people healthy, which is a very big problem. Less a problem in the UK than it is in other parts of Europe, where reimbursement is tied into actually attending to risk factors.